I need to do this. I need to do here is to do this and that. And then let's share tools, share desktop. Okay. Let's see. 20. And we have 10. We have 20 here. And we have 5, 10. Missing 2 people. Huh? Yeah, that's 1. But we need another person here. So all of the side is good. We have 1 missing person there that I know of. Well, I don't know of. Who sits there, guys? You know who sits there? I don't want to call all the names, but we'll get to that most probably. Treasures. Now we're missing 1 extra person. So I have 20 here, for example. And then I have 5 and 5. So that's... Huh? Who? As we'll see. Okay. Here we go. So this is the second lecture on the same topic, the impression materials. Same chapter, but it's a little bit of a juicy chapter, I guess. And that's why we did it in half or 2 parts. And most probably going to watch a lot of videos. We have a lot of videos to see. Let me bring that up here so I can okay. Let's go back here. A few things, and then we go back to the... Okay, so in the last lecture, we start talking about the impression materials that we have, and we said that we have mainly 2 parts, right? 2 types of impression materials. So we have what on the left side is the... No? Elastic, right? Elastic materials. Let's see. And then here we have the inelastic material. Again, this is just to remind you what we talked about, because the other day we talked about what part of the elastic materials? Alginate, which is a hydrocolloid, right? So we talked generally about all of the hydrocolloids that are part of our elastic impression materials. We said that inelastic ones, we're technically not using them anymore, so we're not focusing on these. But for elastic ones, yes, we're using them, and that's why we're focusing on them. Again, last lecture we talked about hydrocolloids, which were mainly the alginate that is irreversible. This is what we start doing in the lab this week. It's a good material, and we know it's used for what impression? Primary, right? The preliminary impressions, the impressions. A good quality, like a fine quality of the detail, but it provides us with enough quality to work with to do the things that we want to do. Again, like you know, whitening trays, sports guards, some retainers, all of these things, we can do that with the Alginate, which is an irreversible hydrocolloid. And we said agar is not used anymore. It was the reversible. Today, we're going to focus on these, which are the elastomers. So the elastomers are the other part or the other category in the elastic impression materials. So we'll talk about polysulfides, polyether, silicone, and the hybrid type of elastomers. There we go. We got them. Welcome, welcome. Okay. So now again, we're talking about elastomers. How many types of elastomers we have? 4, exactly. So we have 4 types of elastomers. We said we have polysulfides, polyether, silicone, and hybrid. And you guys definitely going to get to know these. We're going to mix each one of these most probably in the lab. But we'll see what our focus will be on. If you remember from last slide or the last lecture, when I showed you that slide that shows the impression materials that the silicone was the most widely used in dental offices. So that's why we'll be focusing a little bit more on silicone here and a little bit. And you can see that silicone has 2 types, right? You have condensation silicone that is not used that much anymore. And then you have additional silicones that we'll talk more about. Okay? Generally, for elastomers, we have some qualities that we're looking for. So the material can be either, you know what phobic and philic means? Phobic means, yes, right, water hating, so it doesn't wet well. Hydrophobic. And we have philic that, you know, loves water. So this is something that we're looking at, because if a material is water phobic, if it doesn't wet well, we need a dry field. We need to kind of, the mouth of the patient, we want it to be more dry to take a good impression for it. And you'll see that the silicone that we'll talk about, the polyvinyl siloxane that we'll talk about, it's a little bit more hydrophobic. While polyethers, on the other hand, are more hydrophilic. So they are more wettable. So they're a little bit better on that quality. You know, you can take an impression with a little bit more wet field and great impression. So now the other property that we're looking at when we're looking at elastomers in general is the plastic recovery. The elastic recovery. So 2 things: is it good with water, and is it elastic enough? So again, remember we have 4 of these. We have polysulfides, polyether, silicone, and hybrid. So polyether, we said it's more hydrophilic, which means, you know, it gets water well. So hydrophilic, but it's not as elastic as the PVS. And the PVS is the silicone, actually. So it is really good with elastic, but it's more hydrophobic. Again, I know I'm talking too many words here, but as we go there into each one of them, you'll see what we're talking about. Technically, as I was saying, these are the 2 main used ones in here, the polyethers and the silicones. Polyether is good with water, but it's not that elastic. Silicones are really elastic, but not good with water. And that's why we start making hybrids. So we put silicones and technically ethers, and that will give us the good wettability. So hydrophilic material that is even. Anyway, again, as we go further, we'll get to know more about these. And then the use of adhesive, as you guys all have taken, well, not all of you, but as we take dental impressions, you'll see sometimes the off will be removed or not come out with the impression tray as you take it outside of the patient mouth. And especially with these elastomers, because they're more rigid technically than alginate, so sometimes they can stay inside the patient mouth, and that's why we need to use adhesive on the tray. Again, this will come in a little bit later. But so far, we know 4 materials that are elastomers: polysulfide, polyether, silicon, and hybrid. Okay. Now we're going to talk about silicon, and I think the best thing to do, well, let's finish this slide, and then I'm going to show you a video. So generally, yeah, go. So polyether and silicon are the, mainly these are the main used ones out of these technically. And what I was saying is that a good thing about polyether is that it is hydrophobic, philic. It wets well, right? It gets more. You can work in a wet field with it, but it's a little bit rigid. It's not as elastic as the silicon. I do have that in a slide later on, so don't worry that much about it. At the end, we do have like a small comparison or a table between these. But silicons are good elastic, but they're not as hydrophilic as the polyether, right? And that's why we made hybrid, as I was saying. So it gets both quality. The hybrids will be good elastic from the silicon and will be wettable from the polyethers, something like that. And technically, this is a polyether, but again, we're going to talk about more about these things as we go forward. This is the polysulfide. This is a putty type of the polyvinyl siloxane. Anyway, so here we go. Here, okay. For now, we're going to talk on the next, I don't know, 5, 6 slides about silicon specifically, right? That one material here. So for silicon, it has 2 types, and we already know that. We have a condensation, and we have additional silicon. The condensation silicon is the old one. We're not using it much anymore. So it sits through condensation. It has an ethyl alcohol as a byproduct. It actually is not as good dimensional. It doesn't have good dimensional stability, and that's why we're not using it anymore. So we're not using condensational silicon, but we're using what? Additional silicon. The additional silicon is PVS, right? And that stands for polyvinyl siloxane. You can say polyvinyl silicone, right? Sometimes they call it vinyl polysiloxane, so you'll see VPS. If you look in our lab, you'll see that one of the drawers that we have, or the cabinets that we have, it says PVS on there. That's where we save our polyvinyl siloxane. So PVS, you'll hear that more. And as you go outside, in the field, they'll call PVS. No one is going to say polyvinyl siloxane, all the word. But you guys need to know this is what it is. And again, you can play on words and do vinyl polysiloxane or polyvinyl siloxane. And it is the most used one. Remember, again, from that slide that I showed you before, it was the most used in the dental clinics. And some offices or some dentists would prefer the polyether, as we'll get there in a minute. But these are the most widely used ones, and they're just getting better and better to represent better quality. Okay. Now, I need to show you a video, I think, so we can kind of at least relate. What are we talking about? What is this material? So we kind of saw Alginate. We already saw a video about that already. So let's take a look at polyvinyl siloxane. So this is like what it does for byte registration, and when we put the gun dispensing. Let me see, dispensing gun. Polyvinyl siloxane 1 and 2 steps impression. We'll look at that. 2 steps on a patient. Yeah, let's take a look at this for now. And maybe we can look at this too here. So let's go ahead and share another screen. We will share. Let's share this so we can move freely.
Grammarly can help you write quickly and confidently.
I'm so happy. Okay. Let's see. So remember, we did talk about byte registration before, and the main material used for byte registration is polyvinyl siloxane. Before, they used to use waxes, but now they're using polyvinyl siloxane. So I just wanted you to see how does it look like, you know, what are the things that we're using, just to get an idea.
This video will demonstrate taking polyvinyl siloxane byte registration, which is a record of the patient's occlusal relationship. To assemble the automix gun, push the plunger release upward with the thumb. While holding the lever up, hold the plunger all the way back into the dispenser handle. Open the cartridge lock by lifting up the top clasp. Orient and insert the material cartridge with the V-shaped notch.
That is the main method that we use the polyvinyl siloxane. So it comes in these cartridges that has a base and a catalyst in one place, right? Like in one is base, one is a cartridge, catalyst, and then we put a mixing tip here, and we use the dispensing guns. You will see we also have tubes that you can just have a tube of catalyst and a tube of base, and you can mix them in hand, which nobody do anymore. But we'll do in the lab just to get you the hang of it, you know, just to see what it was, you know, how we used to do it before. But most of the offices now, well, actually almost I say all of them, the polyvinyl siloxane is just a gun. And you can see right there how much easier it is compared to alginate. Alginate, you have to have the canister and the powder, and you have to fluff it, you have to put the measures, and you have to put the water, and you have to mix and all of that, right? This just put it in the gun and you're good to go, right? It gives you measures, it gives you the right mix. It is much better than alginate. The only problem is it's just more expensive. And that's why we're still using alginate, because it's a little bit more cheap. Otherwise, this is much easier. There is, it comes in as well, what they call it putty. And I'll show you another video also about it. But polyvinyl siloxane comes technically in about 3 shapes. It can be in a cartridge, it can be in tubes that you mix by hand, and it can be as a putty that you also mix by hand, but it's more, you know, thick. While alginate just comes in one form. It's powder. Right? But let's take a look what they're going to do.
Down. Load the top clasp to lock the cartridge into the dispenser gun. Advance the plunger to enter into the cartridge. If the plunger does not enter into the cartridge, check to see that it is properly aligned. Remove the cartridge cap by turning it 90 degrees. The cap will be reused for storage. Install a mixing tip on the cartridge by lining up the V-shaped notch on the outside colored rim of the mixing tip with the V-shaped notch on the cartridge flange. Once inserted, rotate the cap 1/4 turn clockwise to lock it into place on the cartridge.
And definitely we'll do this in the lab in the coming weeks.
Into the tip, as it will set, and a new tip will have to be attached. Barrier the automix gun with the clasp.
A lot of times they would not really do that in offices because, you know, if you have clean hands and you're doing this, you should most probably, if you really get a system where you don't, you know, we do that.
Ask the patient to bite normal back teeth. Ask the patient to open widely. Retract the patient's right cheek with the index finger of your left hand. Point the tip onto the occlusal surfaces of the most distal mandibular tooth. Slowly squeeze the cartridge to extrude material.
And you can see how this thing is just mixing it for us. The mixing tip has shape, like a helix in a way, right? Is it called? Huh? Yeah, something like that, like this, whatever it is. But it mixes it for us. So that's a good thing, and that's why you get a good mix. Usually you would extrude a little bit out just to make sure the mixture is correct. Anyway, that will be in the lab.
from side to side.
I don't advise that, but no, I guess
You should release the handle in squeezing again.
there are different
You
ways.
need 3 squeezes of the cartridge to cover the entire handle. Finish at the most distal point of the opposite arch. The entire process can take 30 seconds. Instruct the patient to bite down and hold for 1 minute to allow the material to set. Remove the byte registration and inspect it to see that all the structures are.
You can it is like a rubber. When this material sets, it's exactly like rubber, and that's why we call it like silicone, because it's kind of silicone again. It's like these. I don't know if you've used these like guns to seal something, right? You know, and when they dry, yeah, the caulking kind of, right? Because it's also silicone, right? So it will set and you'll feel it's like rubbery. This is a little bit more rigid, but it's really again, it's like rubber. It would not change. It will not gain water and dry. You know, gain water and swell, or lose water and dry, and so on and so forth. So it is a great material. You're going to work with it a lot, and we're going definitely to work with that in the lab. I think we can go back now to our screen, and I'll go back and share this. And now that you at least have a look at what this look like, we can kind of talk more further about this. Okay. So we're talking about the silicone, and we know that silicone has 2 types. One is condensation, which we're not going to talk about. That is old, that is not used anymore. It doesn't have good dimensional stability. We're going to talk about additional silicone, which is the main use type that we have in the offices that we call polyvinyl siloxane, which is PVS, right? And you can see in this picture, I kind of show you, these are the cartridges, and these are the other putty type like material. We're getting there, actually, in a little bit, yes. So additional silicone, that is what it is, right? The PVS, and it is the most expensive. That's why, again, we don't use it that often to take just regular first impressions, just for crowns and bridges. It has the smallest dimensional change. So again, this is the great thing that we want to have when we take an impression. We have the least, if we can have the least dimensional change, this is what we want to have. Stable for at least a week without distortion, while Alginate, how long we have to wait before we pour it, or what is the maximum time? If you take an Alginate impression, you have to pour it with stone or plastic within a week without distortion. And most probably you can pour, take that and pour again and take it. So again, you can see the differences. These are much better materials. These are just very good for our work. So we said it is hydrophobic, right? That's the problem with siloxane. That is the one technical problem, if we want to say, with polyvinyl siloxane. Again, and the new materials that we're having, they're just making it even more hydrophilic because of it. So it must be used in a dry field, or work better in a dry field. Sometimes we can put a wetting agent to make it even better. Okay. So again, we're continuing to work on this. So polyvinyl siloxane, good. Don't have a lot of dimensional stability. One problem is hydrophobic. And continuing. Now, these are the colors that Olivia asked about, right? And these are viscosities of the material. So again, when we were talking about the differences here, alginate just comes in one thing, one form. It's powder and water. The only thing that I can do is make it fast setting. It doesn't usually come in viscosities. There's no like read about. They are making some alginate that have 2 viscosities. So one that is a little bit thicker and one a little bit, let's see, just in case there's something, because this is, hopefully they are, no, let's see. about now? What is, yes, she can? Okay, great. Thank you. Always need someone at home to check for us. We'll take turns. So it comes in viscosities, you know, how thick the material. And as you can see, we have about, what, 5 viscosities. We have extra light, we have light, and we'll talk about why we call these wash, but technically we can call these wash materials. We have regular or medium, which they call monophase. We have heavy body, and then, by the way, they call them body. So light body, heavy body, medium body. This is what they call. And then we have the putty type, which you do not want to mix with latex or nitrile gloves. What do you think? Latex. So because latex gloves can change the setting, can alter the setting time. So that's only with putty, because putty you have to mix it with hands, with actual hands, with your hands. And that's what you see here. Again, you can see we have different colors. It says here, like, this is the light body, this is a wash, this is a medium body, and this is a heavy body. And technically, which one do you think, guys, is more, will capture the more minute and small details? The heavy body or the light body? Light body, right? Light body, because light body is less viscous, so it flows better. So that is the thing about the polyvinyl siloxane. We actually use 2 viscosities usually to make the final impression. You actually use the head body to take that 1-2 that you're actually trying to work on, right? So for example, if we're making a crown, so I have to take an impression for all of the arch. So we take the impression for all of the arch with on, because that light body can flow better and can capture this even more, right? And that's why we call it wash, because that's the technique. The heavy body, you know, where you take the general impression, and the wash is what you put on that specific to take the impression. Okay. The light, yeah, is wash material, and the heavy body and the putty. The putty is technically it's heavy body in a different form, as I will show you in a minute. It comes like, it's like what do you call this? Play-Doh. You make the bowl and it'll start bouncing and all of that. So putty is nice. Latex gloves with it. Okay. Just like Alginate, it comes in fast and regular set by adding retardants or accelerators. And then one thing about it, see this note here, we're saying that if you pour the impression within the first 2 hours, you'll get a porous cast, because as it's setting, as the material, as the impression is still setting, it is releasing hydrogen. So this is something just to keep in the back of your head. If you take an impression, you know, with polyvinyl, for these impressions, we send them to the lab, and the lab will do it for us, right? While with Alginate, we want to pour it right away. To pour the PVS impression right away. No, right? We have to wait for at least about 2 hours to get better results. Again, that doesn't mean it will be like super bad or anything like that. But again, for best results, you want to wait for about 2 hours before you do that. Okay, we'll see this, finish this, and then we'll watch a video. So as I was saying, it comes in different forms. It's the same material, polyvinyl siloxane, PVS, but it comes in different forms or dispensing systems. So the ones that we saw in the video was which one? The cartridge and the gun, right? Which is this thing here. You have a cartridge, and you have the gun, and you have mixing tips, and that's how you're going to dispense. You also have big cartridges and mixing machines instead of guns, like this one machine. And this machine is called Pentamix. Pentamix. Is that clear? Do I need to zoom in? Pentamix. It's just a other companies. I think they call it differently, but it's probably in the offices as Pentamix machine. Okay. So usually the Pentamix is for the heavy body stuff. So if you want heavy body, you know, you use the Pentamix with the big cartridges. You don't use light Pentamix because light body is just a specific amount. So that is another dispensing system, which is the machine. Putty, which is this thing here. See these? You can see we have scoops for it. Again, it's just like Play-Doh. You have the base and catalyst. You take equal amounts. You mix them with your hand. Consistency. So we use it for general impressions in general. You have tubes, which is the hand mix, these things here, which nobody uses anymore. So just know that they're there. This is how it started. You know, they use tubes first and then mix it with their hand. They have to load it in a syringe and then they have to use it. It's just, but anyway. You form it and you put it on the tray and then you take impression with it. Yeah, so once you do it, you can make it as a like a cylinder. So cartridges, big cartridges, putty tubes, and now we're having these new things that they call them digits. And this is just mainly for wash. So digits are just small cartridges. You can see how small they are, right? They're just small, tiny cartridges. Because again, the wash material, that is the light body material, right? We don't need a lot of it. We just need. While the heavy body material, we might need a big machine, right, for it, so we can actually pour more of it. But again, a lot of offices just use gun for heavy body and light body. Is it clear? Yes? That's why.
How do you do that? Doing the heavy part and then the light for like 1, 2.
Let's take a look. Yes. Yes. Because the assistant, us, fill the heavy body on the tray, and the dentist do the light body on the. So it's. Okay. Elizabeth, can you see this here from home? Hello from. Can you see it? Yes. Yes, she can. Okay, here we go. So this is a great video. You can see these are what's polyvinyl siloxane, right? These are in cartridge form, small cartridge. Well, how about this one thing here? That's the machine one, right? That's the big cartridge one. How about this thing here? Huh? No. This is actually the adhesive. This is the adhesive most probably that they use. These are the mixing tips for the machine. These are the mixing tips for the cartridges. You can see even the mixing tips, we have colors in them. So the light body, we have a smaller diameter mixing tip, which is usually yellow. The heavy body, we have a larger diameter, which is usually teal. And it's also the same, we use it for Byte Registration, the teal one. Again, we have a handout for that in the lab. And you're going to hold these things, work with them, but I'm just saying. And this is another type of system. Looks like the digits, but you can use it with your existing light body. Anyway, let's take a look. What is this machine? Pentamix, right? Pentamix. Pentamix. You can see it's extruding it for you. And you see the tray that she's holding? What type of tray this is? Is it full arch or quadrant? It's a quadrant, and she flipped it. She flipped it, right? That means she's taking impression for both arches, and that is a quality that can be done with only one type of tray. Triple tray, triple trays. The triple trays are the only trays that you can take impression for both arches at the same time. And this is a quadrant triple tray, and this is most probably actually for byte registration. This is a triple tray for byte registration impression. Yes? No, we're not focusing. And you can see again, they're extruding enough material on both sides. Looks nice. See the triple tray. Now we're going to get the patient to bite. This is most probably heavy body. We use this, I'll show you later, but this is technically to remake a crown. So what we're trying to do in this procedure, this patient has somehow is not good. So we're going to break it off, prepare the tooth a little bit better, send the impression to the lab to make a good crown. But before we have to make a what? Temporary crown. We don't want them to leave with no teeth, right? So to make a temporary crown, we make an impression first for the tooth before we prepare it. So we get a mold to make a temporary that looks like the original one. Make any sense? So now we're taking an impression before we even touch the tooth, okay? And keep it with us. Once we prepare the tooth and all of that, right? We use that same impression to make a fake tooth for the patient just for, temporary period of time, as you'll see in a minute. So this is polyvinyl siloxane heavy body using a triple tray impression tray, and it looks nice. And it's a quadrant. Usually they take a quadrant more than a full arch. Now, what is this? Byte registration, right? This is byte registration using polyvinyl siloxane, and you can see they're doing that without going back and forth. So you just need to extrude well, starting with last posterior tooth and moving on. Usually I stop and then start on the other side, but anyway. Siloxane.
Yeah, for both the impression and byte registration.
Exactly. Yeah. Yeah. Byte registration mainly done with polyvinyl siloxane. Even if you're using Alginate to take an impression, you can either have wax to take byte registration, which nobody's using anymore most probably, or you use polyvinyl siloxane. Yeah, and the thickness or the viscosity of the byte registration material is a little bit, well, it's looked like the heavy body, but a little bit less than heavy body, and it's less detail oriented. Like it's not as good details. It would not produce like good details that we get with the heavy body. So it's a little bit inferior, but it's really good for what we need it for. Just a byte registration, but it's still a PVS. Make the patient bite. Now the dentist is preparing the tooth. Not preparing, actually, he's cutting the previous crown. So see, he or she, they're breaking the crown, the existing crown of the patient tooth. I don't think there's any sound in here. You can see this, what do you call this? High speed, right? A high speed handpiece. And you can see it has a light in it, right? So there you can see some of these high speed handpieces that have a light directly into it, which is really great because, you can see what you're working on. See, they're breaking the old crown here. This is the high volume evacuation, right? And they broke it. Boom. This is they had a conroll there. Now they're preparing the tooth for a crown. Doing more work. This is called a barrel. They're checking the clearance. Do we have enough space to make a crown? So when a crown comes in here, we'll have a good occlusion. Again, that's what the dentists have to do. Now they're packing a cord. I'm giving you too many information for the front, for the more to go. But, we do a cord packing. That means a thread that you put around the gum to open. They're packing it around the tooth edges so we can get a really good impression of the edges of the tooth, because that is the most important part that the crown will sit on. That's a conroll there. You guys use conrolls yet? Yeah? Not yet? Oh, not yet?
They showed us in radiology yesterday.
Right, yeah. This is a conroll generally, to control moisture. We don't want any that's in the place. Dentistry work is, one of our main enemies for our work is the moisture, especially the saliva. And see, they're fighting the patient tongue there. You'll see, yeah, your hand will get tired of the tongue. It's really strong. See, now we got a really nice edge all around the tooth there and all around that other tooth. And now, let's see. So this is what PVS, right? Polyvinyl siloxane. But because it has the yellow tip on it, this is actually the light body. You always want to extrude or bleed the cartridge if you're first using it to make sure that you have equal amounts of both. Again, stuff here, but so see, extrude just to make sure you have equal amounts coming out. This is something similar to the digit that I showed you. It's just instead of buying separately, you can just use the syringe, and you're going to extrude some light body material into it, because again, you don't need the whole cartridge for light body. You just need few, just small amount of it. See, just like that. And you can see we do have this in the lab, but boom, it's like a bird of some sort. So again, this is just for the light body. This is for the wash material. Yeah. Now, what are we doing? Now we're putting the wash material, which is the light body, where? Right? On these teeth that we prepare. You'll see they're not going to put it on all the teeth. And that's why we don't need a lot of the material. See how they're putting it there on the edges, all surrounding the teeth. Because this is where we want the most material to go. This is where we want the best details to get. And that's why the light body, it flows better. And we use it as these minute and tiny details. Just filling these teeth, as you can see. And now the assistant, us, is going to fill a tray with the heavy body material, right? Which is, or putty material technically. And you can see now they're using a full arch tray instead of, multiple tray or triple tray. Boom. Exactly. So usually you work together. The dentist will cue, say, go, and you're going to fill the heavy body into the, and now you can see how they will connect together. Exactly. Yes. Yeah, we have a light bulb moment here. So yes, exactly. The dentists start working with the light body and tell you go, and you start doing this heavy body on the tray, and they're placing the light body on the tooth. Then you give them the tray and they place it on there. And a one-step technique. We have another technique when we do take an impression with heavy body only, let it set, and put light body on top of it, and take an impression, which I'm going to show you in a video. So sometimes people prefer that technique and they say it gives you more details, especially if you're taking a full arch, instead of doing that. So you'll not take really a correct impression with heavy body. You'll just take kind of the shape of the arch. You'll see we'll put a separator. So it will be like you're making a custom-made tray. So it will fit better on the teeth, and then the light body will give you that great details that you want. So it's kind of dentist preference and depending on the case. Yeah, but you'll see we have a slide about two-step and one-step technique with polyvinyl siloxane. And this is technically considered as one step because we're doing... We have a great impression. Now what we're going to do... So they're going to take another Byte registration with the teeth drilled. Some dentists do that, some don't. Because that's another Byte registration. Polyvinyl siloxane, same thing. You can see if you missed a few things, you can just go on around the teeth after the patient closes their mouth, and you can do that. Now, what was this impression? That was the first impression that we took in the video, right? The first thing before preparing the teeth. And the material that they're going to put on it is plasticky material that is crown material. You'll see they will put it only on the teeth that were prepared, because these are now look like the original teeth, right? Before we prepare them. So we're going to fill them up. Again, we're going to do all of that in the lab and, sometime, most probably next semester. And then make the patient bite on it because it fits on their teeth like a glove, right? And now you see they have their teeth back. But these are temporary teeth. You'll see they remove them. They're going to clean the temporary stuff out of it. See how they look nice like the actual original teeth before preparing them, right? They're just going to clean up that extra. Boom. Remove. Clean up. And then, guys, we actually can do this. This is something that we can do and most probably you're going to do. So doing like the temporary crowns is a good skill to learn and to be able to do. Some of you will be really awesome with it. Some, sometimes when we make these temporary crowns, the patient will not come back. They think that they're the original ones because they're really nice. They look really good, right? So see, they're now just removing the excess so that we take them out of the bites, smoothing them because we don't want the patient to bite on them hardly. We don't want them to chew on, sticky food because they're temporary at the end of the day. And you can see these are their teeth, but again, in a temporary material, we put some glue, which is technically, this is most probably flowable composite. And then we're going to place it in there, light cure it for a second. See, as he's holding it, most probably, we're going to cure it. Cure. That's the curing light without any barrier on it. So just a small cure just to get it set at the beginning and then removing the excess glue material technically. It's the AC, I think. And now they're flossing to make sure that there's no excess material between the teeth. And there you go. This is another interdental brush, just again to make sure that we don't have any excess material in between the teeth. Any excess glue, so the patient can actually still floss with. It's not worth it to make separate ones because they'll break. It's better to have them like that way so they would Yeah, definitely. Because it's not a bridge, it's crowns, separate crowns.
That they could still floss, but if it's connected, you give it.
Well, I would maybe most probably they would floss on the other side, just that part. And again, we wanted to be really careful. So they kind of put the floss in and thread it through instead of pulling it out because it can pop that out, right? But you guys understood how we did this, right? We took the impression before we prepare it, and then after we prepare it, we used it by using some material. Now, what are they? What are they taking? They're taking an opposing arch. We didn't work on that arch at all, right? We don't have anything to do with this arch, but we're making crown for the mandibular arch, and we make it too long, it will not allow the maxillary arch to sit well. So we have to take an opposing arch, send it to the lab. So when the lab technician makes the crown, they count it and say, okay, the patient bites this way, and this is the space that I have to. Okay, opposing arch usually is made with Alginate because you don't need a lot of details. You just need a regular details like we do with our material. So I think this is Alginate. Yeah. Boom. That was a good video. Well, it depends. But it is not intended for more than 2 weeks. Because usually 2 weeks, that's when we get our permanent one from the lab. That's kind of the time. And then, the patient comes in and replace it. Usually it would, fall down. The patient have to come back and we have to. And then in the new clinics, you don't even need to do temporary crown because you have a milling machine sitting there and you make the crown right away. And you the temporary one? Really? It works sometimes, right? If it's glued well, again, I mean, if it's glued well and if you're not eating too much hard food on it and doesn't break, you can use it forever, but it's not good, definitely. And we make these crowns, because of the looks of the patient. We don't want them to go out with no teeth, and also to preserve the gum, because if we didn't put it, the gum would overgrow and will not have that margin that we had before. So to preserve the space, the teeth can move in. So there are a lot of uses for these temporary crowns other than the actual looks of the patient. Okay, so that was a nice video. I think we can go back to our slides. I think I wanted to show you the two steps. Let me show you the 2 steps technique just to get that out of the way. Again, all of these videos are there for you guys. This is the 2 steps on a patient. This is 1 and 2 steps impression generally. Let's take a look at this one. Are we still sharing or I stopped sharing? I stopped sharing.
We're now going to demonstrate a 2-step impression. It uses a putty wash and a spacer.
I was thinking, is there someone that joined us at home that is male, an old male person? Okay. So this is the 2.
This armamentarium for the impression. You have a small square of plastic wrap that you cut out. You have adhesive for the tray, timer so that you can properly gauge the set of your impression materials. We have a light putty fast set wash. We have our putty, it's a PS putty. We have it out for the proper size.
This is how the putty looks like.
And that's the things we need to make the impression. The most common mistake in taking an impression is using an improperly sized tray. There's 2 things to consider when selecting a tray. One is that the tray needs to completely cover the teeth without touching the teeth or the gums. And it needs to extend behind the last tooth in the arch. So if we were to look at a tray on this model, we would see that this tray fits in every way except it does not extend behind the last tooth in the arch. So if we take another tray, you can see that this tray extends past the last tooth in the arch, and it does not touch the teeth or the gums. That's a properly sized tray. I'll show you how to get the tray properly.
On the patient?
Yeah, by looking for you like a try run.
You have to place and try it in. You have to do try in to make sure. Sometimes they wrap it in plastic paper or plastic bag so that you can reuse it, because these are plastic ones, disposable. So we're going to do that also next semester, most probably.
Now I'm going to demonstrate that on a live patient. You
Yeah.
can see clearly that the tray extends past the left tooth and the arch on each side. You're also seeing that it doesn't touch the gum tissue all the way around.
They have a lot of clearance.
In fitting the upper tray, you place the tray.
You see how they rotate it in by pushing the gum.
Making sure it doesn't touch your gum tissue like you. As I said before, the use of tray adhesive is very important. Adhesive, you don't know if and you may have a small distortion in your impression. So place the adhesive on the tray and let it set for a few minutes so that the solvent can evaporate. Now let's do the lower tray, placing the tray adhesive.
Okay.
Once you place the tray adhesive on, you need to set the tray for a few minutes for the solvent to evaporate. Now we're ready to start making the impression. So we have to mix the putty. You take the putty, this is fast set putty, so you have to work fairly quickly. And you mix the putty.
Just like a Play-Doh.
Without streaks in it. You have about 30 seconds, so it's not a long time to work with the putty here. So when we get the putty mixed, we have a nice even mixture. We make a little sausage, and we place that in the tray. Then we take our spacer, place that over the material, and we just kind of make a little channel of indentions with our thumb. Then we take this to the mouth.
So this is the two-step. Again, this is the two-step impression.
Impression right to the mouth. Place it in. Get the lip out of the way. And then you have to press firmly down. Making sure. There, that's perfect. When you're placing the tray, have your patient lift their tongue up so it's not under the edge of the tray. That way it doesn't get in the way when you're pressing down. After 1 minute, you can remove the tray. Remove the plastic wrap from the tray. Now you do this before this material is completely set. Now we take our light body.
So you see, like we didn't really get all the details. We just got a rough details for that.
And we express that into the indentations in the tray. You don't need a lot.
So that's the wash material. And again, see the difference is this time we didn't place it on the tooth. We placed it on the tray. Right. Sometimes they even place it on the tooth. It's not, I mean, a big deal, but it's still a two-step way in a way.
And we go back, directly back into the mouth with the tray. Press down. And we set the timer for 2 minutes. After 2 minutes, we'll remove the tray. And we get a very nice impression, as you see right here. No pulls, no bubbles. Looks great. When you really have to.
And same thing for the maxillary arch. You take it, you pour, you do the, light body. You take another impression with it, and then you're done, and you got your this. Okay. We're good. So let's just fill these out since we talked about them. Let me see what I have here. My computer slept. I need to wake it up. And let's go ahead and share my screen. Okay. Are we good, guys? Yes, all of that is clear, was clear. A lot of fun. Let's go ahead and do a few of these slides. So the polyvinyl siloxane impression techniques. This is what we wash. Technically, it's called putty wash technique. And I can see, again, the two colors in here. So you have one-step technique and two-step technique. And the one-step technique, we put the heavy body on the tray, right? We put it on the tray and the wash on the tooth. Same time. That's the word. Same time, right? Two steps. You take it again. Putty can be a heavy body. These are like same thing. It doesn't matter. But usually for the two steps, we use putty then heavy body. Because because as you saw, it's much better. So you put it on the tray, and then you put the wash on the tray as well, and you take it again. And that's how you do the two steps. So you take an impression with a putty, get it out of the patient mouth, put the light body on it, on the tray, and then take again. Okay? Two step, one step. As I said, heavy body usually comes in the cartridges. The putty comes in these, the ones that he was playing with, like a putty dough. So the consistency is the viscosity is a little bit different. The putty just comes in a Play-Doh that you can kind of work with your hands. The heavy body is like you extrude it and it flows a little bit more. So at the end of the day, it's a dentist's preference to use putty or heavy body. You can use both in a way. But they're both polyvinyl siloxane. It's just the technique. Okay, byte registration. We know we can take the byte. We inject the material on the closed surface of the mandibular teeth, right? Of the mandibular teeth. Some practitioners can use a byte tray instead of just extruding it directly in there on the mandibular tray. And then we have a polyvinyl siloxane alginate substitute. You can see this is Alginate. And it is, and we do have that. You guys come to work with it. It is a polyvinyl siloxane material that is of a little bit lower quality, but it's just enough for an alginate impression. Use it as a substitute for alginate impression instead of having that powder and all of that. It's a little bit more expensive, but it's much cheaper than the regular PVS. It is more dimensionally stable than alginate, right? And it does not need to be poured right away like alginate, where you have to pour it right away and all of that. So that's a great thing about polyvinyl siloxane. They keep coming. The slides keep coming. Are we good? Yes? Everyone is okay? I'm going to stop here most probably, because this needs a clear mind. Yeah, this thing. Yeah, okay. But now I can relate. That's okay. So let's